Hello everyone! So today we are going to discuss about rotator cuff tendonitis. There are four muscles in the rotator cuff, which were supraspinatus, infraspinatus, teres minor and subscapularis muscles.
The rotator cuff tendonitis is an inflammation of the tendons that make up the rotator cuff. This condition is often seen along with shoulder impingement and can present acutely following an injury or as a result of chronic, repetitive overuse activities. It is also known as shoulder impingement, shoulder bursitis, or biceps tendonitis. It is a pain and swelling of the cuff tendons and the surrounding bursa. The bursa is a soft sac that contains a small amount of fluid that cushions the joint.
For the prevalence rates in Malaysia, the research was done on the para badminton players and it has shown that the annual injury rate was 10, where the most prevalent injuries were back muscle strain, patella tendinopathy and rotator cuff tendinopathy. While for the incidence, the research was done on the Malaysian badminton players and it has indicated that the shoulder was the most frequently injured with the percentage of 36.9%, with rotator cuff tendinopathy 48.4% and being the most common diagnosis made. For the prevalence in worldwide, the prevalence of tear in each decade was stated in the table below with the ages respectively. Other than that, the prevalence of rotator cuff tear in the general population was 22.1%, which increased with age. For the incidence, the frequency of full-thickness rotator cuff tears was ranged from 5 to 40%, with an increasing incidence of cuff pathology in advanced age.
This condition is often caused by repetitive overheat activities such as drawing, racking, washing cars or windows, and many other types of highly repetitive motions. The other cause is heavy lifting over a prolonged period of time.
The clinical features of rotator cuff tendonitis are pain and swelling in the front of your shoulder and side of your arm, pain triggered by raising or lowering your arm, a clicking sound when raising your arm, shoulder stiffness, pain that causes you to wake from sleep, pain when reaching behind your back, also a loss of mobility and strength in the affected arm.
Now, I will explain about pathophysiology of rotator cuff tendonitis. There is positive correlation between age and rotator cuff tear incidence, and many histologic changes have been documented as people get older. Hashimoto and colleagues were observed on 80 patients and studied that there are thinning and disorganization of collagen fibers, myocyte degeneration, which the connective tissue is replacing by mucus, and lastly, healing degeneration. Other studies by Longo and colleagues found that tenocyte nucleus found in round shape that normally the shape should be flat and spindle. Other than that, overuse of the rotator cuff tendon can lead to downregulation of transforming groove beta-1, or we can call as TGF-beta-1. TGF-beta-1 is a polypeptide member of the transforming groove factor beta superfamily of cytokines. It is a secreted protein that works on many cellular functions, including the control of cell growth, cell proliferation, cell differentiation, and apoptosis. So what will happen? The ability to control cell growth, cell proliferation, cell differentiation, and apoptosis will be reduced, so that patient will be having rotator cuff tendonitis.
Conservative management is a type of medical treatment that focuses on avoiding invasive procedures such as surgery to preserve function. For rotator cuff tendonitis, the most conservative approach is the rehabilitation program. In the rehabilitation program, the patient must decrease the activity that requires the use of the shoulder, such as lifting a box. Second, begin an exercise program to preserve flexibility. Next, apply ice to the affected area. Applying ice has been thought to help decrease swelling and inflammation as well as reduce pain. Other than that, corticosteroid injections are also one of the conservative approach for rotator cuff tendonitis. The steroid is a powerful anti-inflammatory that can provide pain relief quickly and effectively. Last but not least, non-steroidal anti-inflammatory drugs. It can relieve shoulder pain by reducing inflammation in the shoulder joint. The example of non-steroidal anti-inflammatory drugs are ibuprofen and naproxen. When conservative treatments are unable to resolve the chronic pain, patients have another option, which is surgical treatment. We have two options of surgical treatment, which are arthroscopy and open shoulder surgery. Arthroscopy is an ideal rotator cuff tendonitis surgery option for people with minor tendonitis, as it is minimally invasive. The surgeon trims down inflamed tendons in your rotator cuff with very small medical instrument inserted through minor incision in your shoulder and guided by a microscopic camera. Arthroscopic surgery causes less inflammation and pain than traditional open shoulder surgery. This faster recovery time and lessen the chance of muscle atrophy. Open shoulder surgery is usually reserved for repairing severe rotator cuff tendinitis. During open surgery, your surgeon will transfer or graft tissue or muscle from one area of the body to the damaged rotator cuff. Open surgery requires a longer recovery period, but it is equally as effective as arthroscopic surgery in cases of severe damage to your rotator cuff.
Usually, patients with shoulder pain has a good prognosis. Nearly half of the patients with new onset shoulder pain only see their primary care physician once and are almost never referred to a specialist. A follow-up clinical evaluation after 4 to 8 weeks may be necessary if the symptoms are persisting. If pain continues after several months, steroid injections have provided only temporary relief, then surgery will become an option.
Based on ICF components, disorder or disease can affect body functions and structure of the body, and it can cause impairment that can lead to activity limitations. Activity limitations is the difficulties that someone may face in executing activities or tasks, and it can affect someone's participation. Participation restrictions are problems someone may experience in involvement in their life situation. Okay, first, let's look at the impairments of the patients with rotator cuff tendonitis. The impairments are shoulder impingement, limited motion, and weakness of the arm. The functional limitation for the person that has rotator cuff tendonitis are difficulty to cook, difficulty to dress and undress, difficulty to do personal hygiene such as combing hair, brushing teeth, shaving, and etc. Next, they can have difficulty to play sports such as badminton, basketball, swimming, and sports that require movement of the shoulder. Other than that, they can have difficulty to eat, especially food that require using both hands such as stick. Last but not least, they can have difficulty to do house chores. Participation restriction they may face are difficulty for a wife to cook for her family, low self-esteem to socialize with friends or go to events due to difficulty to eat independently, and limited in engaging in sports.